Welcome to Building High Performance Healthcare Teams. This presentation is designed to help you strengthen interprofessional collaboration in nursing and healthcare settings. Whether you're leading a unit or working directly with patients, the strategies we'll explore can make a real difference. High-performing teams don't just happen, they're built through intentional effort and shared values. We'll look at what makes teams successful, how to assess their effectiveness, and how to foster trust and communication. Think of this as your guide to building better teamwork and improving patient outcomes. Strong teams are the backbone of quality care, especially in today's complex healthcare environments. Let's get started and explore how to build teams that truly perform. Let's begin by reviewing our goals for today. First, we'll identify the key traits and behaviors of high-performing healthcare teams. These include things like trust, communication, and shared purpose. Next, we'll evaluate how team composition, such as roles, diversity, and structure, affects performance. Understanding who's on your team and how they interact is essential. Then we'll apply evidence-based strategies to real-world challenges in nursing units. These strategies are practical and grounded in research. By the end of this session, you'll have a clear understanding of what makes a team effective and how to build one. Keep these objectives in mind as we move forward. What makes a healthcare team truly high-performing? First, they share a clear purpose. Everyone is aligned around patient-centered goals. Trust and psychological safety are key. Team members feel safe to speak up and admit mistakes. Open communication ensures that information flows freely across disciplines. Role clarity helps everyone understand their responsibilities and respect each other's expertise. These teams don't just function, they thrive. They deliver better patient care and maintain higher morale. Research consistently shows that teams with these traits outperform others. Building these characteristics into your team takes effort, but the results are worth it. What makes a healthcare team truly high-performing? First, they share a clear purpose. Everyone is aligned around patient-centered goals. Trust and psychological safety are key. Team members feel safe to speak up and admit mistakes. Open communication ensures that information flows freely across disciplines. Role clarity helps everyone understand their responsibilities and respect each other's expertise. These teams don't just function, they thrive. They deliver better patient care and maintain higher morale. Research consistently shows that teams with these traits outperform others. Building these characteristics into your team takes effort, but the results are worth it. Accountability in healthcare teams operates on multiple levels. It starts with the individual. Each member must take responsibility for their actions. Then it extends to the team, where members support and hold each other accountable. Patient advocacy is another layer, ensuring that care decisions prioritize patient well-being. Accountability also involves upholding organizational standards and policies. Finally, it includes a commitment to the profession, advancing its reputation and best practices. When accountability is embraced at all levels, the entire system benefits. It leads to improved safety, quality, and trust across the board. High-performing teams understand that accountability is about integrity and shared responsibility. Ethics play a central role in team-based healthcare. Teams often face complex dilemmas that require collaborative decision-making. Balancing multiple perspectives while staying focused on the patient is essential. Shared moral responsibility means everyone is accountable for outcomes, not just the leader. Transparency about mistakes and a commitment to improvement are key ethical practices. Effective teams also advocate for justice and equity in care delivery. They work to eliminate disparities and address systemic barriers. Ethics isn't just a set of rules. It's a shared commitment to doing what's right. Communication is truly the lifeline of any healthcare team. When it breaks down, the consequences can be serious. 67% of medical errors are linked to poor communication. It's also a major factor in 82% of sentinel events, which are unexpected occurrences involving death or serious injury. Poor communication can even increase hospital stays by over 2 days. That's why structured handoffs like SBAR and IPASS are so important. Closed-loop communication ensures messages are received and understood. Regular interdisciplinary huddles help keep everyone aligned and informed. Clear documentation protocols also play a key role in maintaining safety and continuity of care. Different situations call for different communication styles. In emergencies, directive communication, clear and concise instructions, is essential, like a trauma team leader during resuscitation. For complex problems, collaborative dialogue helps teams brainstorm and find solutions together. Consultative communication allows leaders to seek input while retaining decision-making authority, such as a physician consulting a specialist. Facilitative communication guides discussions toward consensus, often used by nurse managers in quality improvement meetings. Effective teams know how to adapt their style based on urgency and context. Leaders especially need to be fluent in multiple approaches. Flexibility in communication builds trust and improves team performance. Respect is more than politeness. It's about recognizing each team member's dignity and expertise. It shows up in visible behaviors, common practices, and even in how we address implicit biases. A respectful culture supports psychological safety, where people feel safe to speak up and contribute. When respect is embedded in team culture, innovation and continuous improvement flourish. It also helps reduce conflict and build stronger relationships. Organizational culture plays a big role in setting the tone for civility. Teams that prioritize respect tend to be more resilient and effective. It's a foundational element of high performance. Respectful communication starts with inclusive language. Saying "our team decided" instead of "I decided" acknowledges everyone's contribution. Active listening is another key. Maintaining eye contact, asking clarifying questions, and summarizing others' points shows engagement. When disrespect occurs, it's important to address it directly using I statements, like, "I felt concerned when you interrupted during rounds." This approach keeps the conversation constructive. Acknowledging expertise across disciplines also builds respect. Recognizing insights from all team members, regardless of role or seniority, strengthens collaboration. Leaders set the tone by modeling these behaviors. When respect is consistently practiced, it becomes part of the team's identity. Diversity within teams isn't just a value, it's a performance enhancer. Cognitive diversity, or varied thinking styles, leads to more innovative solutions, especially for complex patient care challenges. Professional diversity brings together different clinical disciplines, reducing fragmentation and improving coordination. Demographic diversity helps teams better reflect and serve their patient populations. This leads to more culturally responsive care and better outcomes for diverse communities. A well-rounded team is more adaptable and resilient. Each member brings unique strengths that contribute to the whole. As the saying goes, the strength of the team is each individual member, and the strength of each member is the team. Team roles come in three main types: formal, informal, and functional. Formal roles are defined by licensure and organizational structure, like RN, MD, or PT, with clear scopes of practice. Informal roles emerge naturally based on personality and team dynamics, such as the connector, peacemaker, or challenger. Functional roles are task-specific and may shift depending on the situation. Flexibility in who performs certain functions can improve efficiency and responsiveness. High-performing teams recognize and leverage all three role types. Leaders should identify and support team members' natural strengths. Maintaining appropriate boundaries while encouraging collaboration is key. When roles are clear and respected, teams operate more smoothly. Team dynamics are the invisible forces that shape how a group functions. Emotional dynamics involve how team members feel and respond to stress, success, and each other. Social dynamics include relationships, influence, and informal roles that emerge over time. Task dynamics focus on how work is distributed and completed. Trust and psychological safety are essential for healthy dynamics. They allow people to take risks and speak up. When these elements are strong, collaboration and efficiency improve. Teams that understand and manage their dynamics perform better and adapt more easily. Paying attention to these hidden forces can transform a good team into a great one. Strong relationships are the foundation of effective teamwork. Building trust means following through on commitments, admitting mistakes, and maintaining confidentiality. Clinical competence also plays a role. People trust those who are skilled and reliable. Conflict is inevitable, but managing it well is key. Address issues promptly and focus on behaviors, not personalities. Seek win-win solutions and use established resolution processes. Collaboration thrives when teams have interdependent goals and recognize complementary skills. Celebrating shared successes helps build collective ownership and pride in the team's work. To improve a team, you first need to understand how it's performing. There are 5 key dimensions to assess. Clinical outcomes measure the health results directly linked to team care. Process efficiency looks at how well workflows and resources are managed. Communication quality evaluates how information is shared and documented. Team climate includes psychological safety, conflict levels, and member satisfaction. Finally, adaptability measures how well the team responds to change and challenges. Regular assessment helps identify strengths and areas for growth. It's a vital part of building and sustaining high performance. There are several validated tools available to assess team performance. Instruments like the Team Climate Inventory and Team STEPS questionnaire provide structured insights. The Relational Coordination Survey and Team Effectiveness Audit tool also offer valuable data. Observational methods, such as watching rounds or simulations, add qualitative depth. Analyzing communication patterns can reveal hidden issues. Using both quantitative and qualitative approaches gives a fuller picture of team functioning. Regular assessments help teams stay aligned and improve continuously. It's not just about evaluation, it's about growth and development. Building a strong team starts with a shared purpose. Collaboratively define your mission and goals and revisit them regularly to stay aligned. Clarify roles and expectations so everyone knows who does what and why. Visual role matrices can help reduce confusion and overlap. Develop communication protocols like SBAR and regular huddles to keep information flowing. Standardize documentation to ensure consistency. Foster psychological safety by modeling vulnerability and responding positively to concerns. Recognize and reward those who speak up. It builds trust and accountability. Let's look at a real-world example. A 12-bed ICU was facing high turnover, frequent medication errors, and poor patient satisfaction. The team conducted a comprehensive assessment using the Team Climate Inventory. They introduced daily structured interprofessional rounds and provided conflict resolution training. Psychological safety practices were implemented along with role clarity exercises and cross-training. Within 6 months, turnover dropped by 65%. Medication errors decreased by 47%, and patient satisfaction improved by 28%. This case shows how targeted interventions can lead to dramatic improvements. It's a powerful reminder that change is possible with the right approach. Team building is a continuous process. Start by assessing the current state using validated tools and team feedback. Identify 2 or 3 priority areas for improvement based on the results. Develop a clear action plan with specific goals, timelines, and ownership. Implement changes with proper training and support, and celebrate early wins to build momentum. Evaluate outcomes against baseline data to measure progress. Refine your approach as new challenges emerge. Remember, team development isn't a one-time event. It's an ongoing journey. Consistent effort leads to lasting results. Let's wrap up with a few key points. High-performing teams don't happen by accident. They're built through intentional development. Communication and respect are foundational elements that create psychological safety. Regular assessment helps teams identify areas for growth and take targeted action. Effective teams are adaptable, accountable, and aligned around shared goals. Investing in team building improves patient outcomes, staff satisfaction, and organizational resilience. Keep applying what you've learned to strengthen your own team. As the quote says, "Coming together is a beginning, keeping together is progress, working together is success."